Welcome. I'm Julie Thompson, Executive Director of pac-tv, and today we're hosting a COVID-19 update for the town of Kingston. We will hold these forums every Friday at 10:30 a.m. Watch in Kingston on Comcast Channel 15 and Verizon Channel 42, or watch online on our streaming channel by visiting pac-tv.org/live. To ask questions during this forum, please email them to kingstoninfo@pac-tv.org. And for forum replay schedule and additional Kingston meeting coverage, just visit pac-tv.org/Kingston. Today's participants include Josh Warren, who of course is the chair of the Kingston Select Board, and also we have Dr. Elizabeth Ryan from Integrated Counseling Centers. Sorry about that. Welcome both of you. Josh, take it away.
Julie, thank you for having us and for giving us the opportunity to bring Dr. Ryan on. I'm certainly excited to hear from her and learn from her and all her experience. As always, thank you and everybody at pac-tv. I know that you guys are working around the clock, not just for Kingston, but for all of your communities. And I sincerely do appreciate it. The feedback that we've received from residents on these updates has been tremendous. We've heard from a number of residents who may not have access to the internet, who may not have access to smartphones. So local news really comes from pac-tv and WATD. And we really appreciate, especially during this public health crisis, everything that you're doing to help us communicate with our residents. Just a few announcements before we hop on over and speak with Dr. Ryan. Yesterday afternoon, the Massachusetts Department of Public Health announced that there were 7,724 confirmed positive cases of COVID-19 in Plymouth County. And as of yesterday afternoon, our total number remained at 88. So Kingston's numbers, if you look at surrounding towns, are significantly lower. Again, I think that has a lot to do with the town's early response to everything that's going on, but also to the level of personal responsibility that all of our residents have taken in vigilantly washing hands and practicing good hygiene and socially distancing. And that's really important, especially as we look to reopen our buildings and our facilities. As many residents know, the Grays Beach Park was opened this week I believe, on Tuesday, and that was a decision that was made by the Recreation Department and the reopening task force once they decided that, given the governor's guidelines, they could safely do so. The beach is open with limited amenities. I don't think bathrooms are yet open. The basketball courts and tennis courts aren't yet open, but and the playground is not yet open. But those things will be coming. And as we open more buildings, as we open more facilities, as Governor Baker said, we're really looking to residents to continue with that level of personal responsibility that everybody's had for the last few months. This is still a very real public health crisis. COVID-19 is in our community, and it's really up to us to protect ourselves, our families, and our neighbors from becoming ill and potentially contracting this. So again, our town's numbers remain at 88. Of that 88, 49 are from one facility. On Tuesday night, Fire Chief Douglas, who's a member of the reopening task force and the emergency management team, presented the reopening task force's plan to the Board of Selectmen, and the Board of Selectmen took a vote to authorize the reopening task force to move forward with that plan and continue to reopen buildings and facilities throughout the town of Kingston. As a result of that meeting and the plan that was presented, we've added a list on the town's website. So if you go to www.kingstonmass.org and you visit the COVID-19 section, there's a big banner at the top of the website, and there's a link at the bottom under quick links that will take you right there. You'll find a list that pertains to the reopening of a number of our facilities. I believe Animal Control, the Council on Aging, the Harbor Master, the library, the Recreation Department, our schools, and the townhouse are all listed. All of the dates that are presented, and Fire Chief Douglas has asked that we really make this clear. All of those dates are subject to change. There could be issues with securing PPE that's been ordered. There could be issues with retrofitting desks for glass screens and shields that will now be installed. Many have already gone in. So those dates are subject to change, but Mark and the members of the reopening task force were confident that we could start sharing those dates. So again, on the town's website, for anybody who's interested in knowing when staff may return to the Council on Aging or the library, or when curbside pickup may resume at the library, all of that information can be found there. Fire Chief Douglas and his reopening task force will keep that up to date by working with Jana Morrissey in the clerk's office and by communicating with the Board of Selectmen. So please continue to monitor it. One other quick update: as the emergency management team shifts from responding to the initial impacts of COVID 19 to really supporting the efforts of the reopening task force, we're no longer going to be issuing the daily advisory letters to residents. This is something that we've done for the last 76 days. We're going to shift to a Monday, Wednesday, Friday frequency. And I apologize to residents who have been looking to the website every day around supper time for those advisory letters. But our focus really on the emergency management team is shifting from the initial response phase, which again, I feel the town and the residents have been very successful in, to supporting the efforts of the reopening task force. So we're going to decrease the frequency on those letters. Updates will continue to be made on the website as new information becomes available. But again, the daily advisory letters to residents will be going out on Mondays, Wednesdays, and Fridays. So, with that, I'd like to introduce, or rather invite our guest, Dr. Elizabeth Ryan from Integrating Counseling Centers, to introduce herself. Elizabeth, I'll turn it over to you.
Hello, everybody, and thank you for having me. Certainly, congratulations to the town of Kingston and um, pac-tv and all of you for doing a really wonderful job. And I'm a psychologist. I've lived in the Plymouth area in Plymouth County for 35 years. I have been in practice with my husband, Timothy Ryan, for 25 of those. Our practice is integrated counseling centers located in Plymouth. We serve many people from the town of Kingston, as well as Plymouth, Greater Plymouth, and a number of other surrounding towns. I'm a senior citizen as well. I'm 69, and so what I'm going to be talking about today, which is how to preserve one's own mental health in these very challenging times of COVID-19, comes as much from personal experience as it does from professional. So, Josh, if you're ready, we can get started.
Sure. I really appreciate you making that introduction. So, one of the things that I wanted to talk about, I know early on, Paula Rossi-Clapp and her staff at the Council on Aging were working nonstop on how to support what really is a vulnerable population in regards to COVID-19. It's been seen that the older population really is susceptible to some of the risks associated with this deadly virus. So we often talk about senior citizens or older adults as being of a vulnerable population. Of course, with COVID-19, it's related to the virus's ability to impact that population. But why are we identifying older residents as being vulnerable? What makes them vulnerable?
Well, it's a great question. And we certainly, a lot has been said about the physical, medical vulnerabilities, but we're really going to talk about emotional vulnerabilities and the ways in which COVID-19 and this time of social distancing is a threat to the mental health of seniors like me. And to start with, I'm just going to throw a few statistics around, but not a lot. And that's that typically, the senior years can be a time of a lot of loss. So there are losses of spouse, friends, and families. For example, 32% of women 65 and older live alone. It's 57% after 85, as opposed to 13% of men age 65 to 74, or 29 after 85. And that's because, of course, men don't live as long as we do. Losses of career, job, income. 33% of retirees have no money saved for retirement in this country, and 57% of retirees live below the $32,000 annual median income in this country. There's losses of functioning due to illness, physical conditions. 9% of people over 65 need help with activities of daily life, and that jumps to 31% by 80 to 84. Why does this matter? Because all of these things make up our feelings about ourselves, who we were married to, what we do, what profession we had and what we were able to do. Now, the, the good news is that we seniors are very resilient people. What's resilience? It's the ability to withstand and recover from difficult circumstances. Despite all of the stuff that I just talked about, 91% of seniors say that they're happy in retirement. Why do we say that? Because we have life experience. And stands us in good stead in a crisis like this because we've been through hard times before. And we've had the experience of living through those hard times and actually even finding ways to flourish and do well. And that's led to self esteem and self confidence in many of us. Many of the big decisions in life are behind us, our education, what career to have, who to marry, and where to live. I mean, these are all big decisions. We've had an opportunity to make peace with disappointments and crises in life. And we know who we are, we know what's important to us, and we know what we believe in. So these are things that stand us in good stead. Now, I think it is important to talk a little bit about depression and anxiety in older people.
Can I ask a question about
You
that?
sure can.
So I mean, I'm 34 myself, and at our house, especially right now, with everything that's going on in the world, with the news headlines that we see, with trying to balance working from home with parenting, with roles and responsibilities as a selectman. My wife's a library trustee. We're overwhelmed. We have bad days. Everybody does. At what point is it more than just a bad day and it's something like anxiety or depression? Are there ways that we can self-identify that it's a bigger issue? Are there ways that, in regards to older adults, that we can help identify that in our parents or our grandparents?
Yes, absolutely, there are. And my heart really goes out to all of you, in the sort of what we call the sandwich generation who are trying to help us, the older generation, and take care, raise young kids in the meantime and sort of often get crushed between all of those conflicting needs. Um, Let me just a couple of statistics about depression and anxiety in older people, how to distinguish that from normal worry and grief. And I thought it would be helpful to give a list of symptoms, signs, things that you can look for in older people, things you can look for in yourself. Anxiety is diagnosed in 7% of people over 65. That's 15 million people. That's a lot of people. For depression, the statistic is 3% or 7 million. Now, it's not a part of normal aging, as is sometimes thought. The difference between worry and grief, and right now, we have a lot of things to worry about. Is it safe to go into the supermarket? Did I touch anything I shouldn't have? Did I remember to wash my hands? I mean, there's lots. Do I have enough money to get through this? There's lots of losses for us. We're not free to go out and see people in the way that we were. We can't go to public events in the way that we could. Life is much more uncertain than it was. But the difference between these and clinical anxiety and depression is that these are typically very subject or problem focused, and they're also time limited. So let's talk a little bit about some of the signs of depression and anxiety in older people. Now, I can screen share and put this list up so people can see it while we talk about it. And let me try and see if I can do that. Okay, we're a little bit ahead of ourselves here. Can you see this?
Yes.
Okay. So, what are the signs of depression and anxiety in older people? First of all, these symptoms often overlap, so that they go together. Some depressed people look more anxious. Some anxious people have some features of depression. So it's not just necessarily one thing or the other. And people don't all have obviously all of these symptoms. Um, Persistent worry, can't stop talking about it, can't stop thinking about it. Persistent sad, anxious, or empty mood, irritability, restlessness, and very important, loss of interest in activities previously enjoyed, including sex. Um, sometimes there's differences between men and women. We women sometimes are more apt to get sort of weepy and sad. Men sometimes are more apt to get irritable and angry. Um, Moving or talking more slowly, or talking less. Somebody gets kind of quiet. Difficulty concentrating, remembering things, making decisions. Difficulty sleeping, early morning awakening, and I don't mean waking up at 6, I mean waking up at 3 a.m. when you have no reason to be up. Can't get back to sleep. Multiple awakenings, or oversleeping. Um, After 10 hours of sleep, you wake up and you're still tired. It's hard to get up. And unfortunately, there are more signs. Thoughts of death or suicide, suicide attempts. People typically don't volunteer this kind of information. You have to ask. Physical complaints, which at 69, I have a lot of aches and pains anyway, like most of you. However, these aches, pains, and often digestive problems, sort of stomach based problems, don't appear to have a medical cause and don't get better with treatment. You take Pepto Bismol, you don't feel better. You talk to the doctor or nurse about it, and nothing seems to help. Frequent crying, eating more or less than usual with unplanned. Now, a lot of us are gaining weight because we're doing a lot of cooking and there's not that much to do. So we're eating a lot and enjoying that. But this is unplanned weight loss or gain. It's eating more or less in a sort of eating more in a compulsive sort of way, not in a way that involves enjoyment. And of course, the big one, social isolation. So I'm now going to stop the screen share and go back to me. I'm back again. Mhm.
Now,
I'm
when
not
we
back.
no, you're back. You're back.
Okay.
When we spoke, and I just want to talk about this quick because social isolation was at the bottom. We talked about social distancing versus social isolation. So now that we know what signs and symptoms are, what are some good ways to maintain mental health? Because I know that's something that you really want to speak to as well. And I think that that's it's one thing to talk about and identify these issues, but then once we've done that, where do we go with it? And I know that you're a big proponent of physical distancing, not social distancing. We can still maintain contact with our parents, our grandparents, our grandchildren, our friends, and we can do that safely. We can do that using a phone. We can do that using an iPad or a computer. We can do that from a safe distance. Why is it so important that we really shift our mindset from social distancing to physical distancing as it pertains to maintaining our mental health and really supporting those who may be experiencing something like anxiety or depression?
That's a really good distinction that you made when we were talking about this program, that social distancing isn't always physical distancing, and it certainly doesn't have to be emotional distancing. Because there are some recommendations about staying 6 feet apart, wearing a mask, using more of the electronic devices that you talked about, doesn't mean that we can't still be emotionally connected with each other. And so, some of the ways to stay social isolation is a sort of cardinal. It sets one up to be depressed and anxious because people are a very social species. We're a social animal and we need other people and we need relationships with other people. So we don't do well in isolation. None of us do. So some of the things you can do to stay healthy, and we'll talk more specifically about how to work social distancing, is first of all to establish a routine. One of the things we all had when we worked is a routine. You have to get up, you have to be somewhere at a certain time, certain things are expected. It's a reason to get up in the morning, it provides a lot of structure for life. So, in retirement, in social isolation, keep a routine, establish one and keep one. It's Friday. Today I call my friend Mary and talk to her. Have scheduled FaceTime on the phone with family. Have a Zoom. We have a family Zoom dinner on Sunday nights. It's a bit chaotic with my son and daughter-in-law and three grandchildren. It's chaotic, and people are, we have the iPad set up, and we're eating and talking, and kids are running around, and some people, sort of suddenly the whole screen spins around and you feel a little dizzy, but it's a lot of fun and it's something my husband and I really enjoy and look forward to. That's what's important about take a walk with a distanced friend. You can do that. You can walk, 6 feet apart wearing masks, and you can actually be in the presence of another person. It's important to have things to look forward to. And the other thing is, this is a time of great uncertainty. Nobody seems to know when will there be a vaccine, when is there going to be a treatment. Having a routine gives us some things that are predictable. Well, I know I can count on this. I can count on seeing my family. I can count on talking to my friends. Sleep hygiene, just a fancy term for sleep habits. Sleep's really important in maintaining good health and mental health. Get up at the same time, go to bed at the same time. You train your body to be tired and you train it to wake up because you've had enough sleep. Good sleep is like a vaccine against depression and anxiety. It's a whole lot harder to be depressed and anxious if you've had a good night's rest. It's a lot easier to concentrate and remember things if you've had a good night's rest. Get started on some projects, a puzzle. Um, a friend of mine, she and her family are doing a puzzle together. He's working on some of it, and then one of his children that he's safe distancing with comes over, and they kind of work on it together. It's a big puzzle, so they can do that. A craft project, build something, identify birds at your feeder. Have some little projects that you're kind of working on. Very important, take time off from the TV. Don't just watch TV all day long. It's very tempting to do that. Um, but electronics actually make your brain are very taxing because now while we're Zooming, the images that we're seeing don't perfectly connect with the words that I'm speaking. So your brain actually has to work pretty hard to make the two, to synchronize the two, to make the two come together. It's very tiring. TV gets you very stimulated. If you watch it at night, it's hard to then settle down and go to bed. Take some time off. Have some time in the real world. Play games, read, meditate, lots of other things that we can do. And very important, limit your exposure to news. It's very important for us all to know what's going on, but a lot of what's on for news is not news, it's commentary. It's what other people think about what's going on, and they don't necessarily know any more than we do. Not to mention the fact that it changes. So now there might be family or friends or caretakers who are watching this and thinking, well, what can I do? And that also speaks to your question, and that's to ask. Don't expect somebody who is anxious and depressed. Don't expect them to tell you, hey, I'm depressed. I think I need you to talk to me. I need some help or whatever. But they may be showing you with changes in behavior or attitudes, some of the behaviors that we talked about. Depression is insidious, it creeps up on people. So you don't notice the little changes from day to day, but people around you may. So don't be afraid to ask. Ask your parent or ask yourself, "Hey, what's going on? I haven't I haven't been reading my book. I haven't felt like talking to people." We've talked a lot about staying in touch and finding ways to break through the isolation. Before we talk specifically about that, I just want to say that people who study seniors and what keeps us mentally healthy and alert um, is that there are three sort of main domains, and we've talked a lot about social contact with other people. One thing we seniors do is we're really good at making new friends. At this stage in life, it's different than when you're younger. It's not about what is your philosophy of life. It's more like, hey, you like to play cards, I like to play cards. How would you like a ride to the senior center? We're faster to sort of say, hey, this person seems nice. Let's uh let's get together. In intellectual stimulation, we've talked about continuing to learn, trying new skills, learning new activities. It's exercise for your brain and it's fun. And the other thing is moving around. Some form of exercise. This actually gives you more energy and it helps you sleep better. And all three of these domains help, they stimulate natural chemicals in your brain, which are kind of like the natural antidepressants and anti-anxiety agents that your body produces. Your brain has some of the medicine that you need, but you need to do certain things in order to have more of that. So people are saying, well, okay, this all sounds great. How are we supposed to do this? Some families and friends are creating what's called the circle of trust or safe closed systems that we talked a little bit about earlier, where you can sort of say, okay, for example, my husband and I have contact with each other and really nobody else. We can't have contact with our son and daughter in law because she's a nurse working at Mass General, so we just can have electronic contact with them. But we have a really good friend who's alone and he's not having contact with anybody. So we decided, okay, the three of us can go for some socially distanced walks. We can have a cup of tea together outside on his deck. We can actually have, um, some safe time together. You can do this with other people.
And that's
Caretakers, children, adult children, get your older relatives on Zoom, FaceTime. A lot of us our generation worked with computers, and those of us who didn't, many of us have smartphones. We can learn, these are easy programs, we can learn how to do this. This opens up the world to you. The senior center and pac-tv may be able to stream live content, i.e., to do what we're doing now, but maybe have an instructor doing chair yoga or tai chi or a discussion group. You can have multiple groups with Zoom, and you have all sorts of little pictures, and people can talk to each other. There are also many free classes that are offered on YouTube that you can watch on TV. So you can take a class for free. Show your older family members how to access this, how to do it. Many of us can learn how. Maybe that's also something that staff at the senior center, can help some of us with. I have some resources that I can show if I can screen share that. So ways for people to look at, some of the sources that I drew from and read some articles relevant to this. And I can also, answer some questions.
that would be great if you could share some resources. And while you're pulling that up, one of the things that I really wanted to share, and I talked to Paula Rossi-Clapp last night about having you on today, and she did say one of the things that she really wanted us to get out to residents today is reach out to the Council on Aging. throughout this entire public health crisis, the Council on Aging has been doing outreach to seniors. They've been expanding the list of individuals who are receiving mailers and phone calls and meals. But reach out if you're experiencing any challenges, any struggles. Let them work with you. Let them help you work through this. Let them connect you with somebody who may have a skill set that they don't have in house if that's what's necessary. So Paula did want me to really make sure that folks know that the staff is there. They've been there this whole time, and they are awaiting your calls. They'd love to hear from you. With that, Elizabeth, do you want to pull up your slide with resources?
I sure do.
Thank you.
Okay, can everybody see that?
Yes.
Great. So WebMD is a search engine online, which has excellent articles written for lay people, so written for everybody, not just, not mental health professionals, about anxiety and depression in seniors. So again, caretakers, adult children, younger friends, senior center staff show people how to access this. It's a really valuable resource. The Anxiety and Depression Association of America, they have an excellent blog post, um, an excellent article, Seniors Coping with Anxiety and Depression, which I found very useful in preparing this talk. And the National Council on Aging, they have some terrific mental health programs for older adults with training materials that are and in-home based. So that might be a really good resource for senior center staff to take a look at.
Great, thank you. And I really liked what you said about having these. I forget the term you used, but sort of a closed circle. What was the term?
It's a like a trusted a circle of trust, or a safe closed system. There's been a lot of talk in from on the CDC and on all sorts of websites about ways to socially distance where people can actually have safe contact with other people. Given that no, obviously no hugging and no touching, but you can be together. You can take a walk, you can have a cup of tea, you can share a simple meal. You bring something, I bring something, it doesn't matter. The important thing is we're together.
And that's similar. In Canada, they have a concept of the double bubble, and
Yes.
where everybody was sort of in their own bubble in their household. They've been allowed to expand that with another household where they know that they're practicing good hygiene and social distancing, and they know that they're practicing good hygiene and social distancing, and for everybody's mental health now, these two households are able to interact at a closer frequency than was otherwise previously permitted. And I haven't seen how that's gone in Canada, but I certainly like from a mental health aspect, being able to expand that circle, expand that bubble. This is honestly the first time that I've ever wished my 5-year-old wasn't an only child. I mean, I see other families who have multiple kids, and they have these great playmates under the same roof. And right now, Saul doesn't have that. He has mom and he has pop, and that's great. But wouldn't it be nice if he had another young person to play with? So I think as this progresses, I think folks are really going to have to right size for themselves how they cope, how they keep themselves safe, continue to keep their neighbors safe and their friends safe. But that concept of a closed circle and a trusted circle is I think something that we'll all probably be exploring in the weeks and months to come as this drags on.
Absolutely. And I talk to patients every day on Zoom, which is we're teleconferencing. That's how we're taking care of people at this point. And I was talking with a woman this morning who has talked to her neighbors. She has a 2-year-old, and she's talked to her neighbors across the street, and they're all pretty satisfied that they're all working from home and practicing, safe social distancing and doing the right thing in terms of keeping themselves healthy and safe, and they're exploring the idea of having the two little kids. The family across the street also has a 2-year old, of having the two little kids have some playtime together. So I think that you're going to see a lot of people being sort of creative and careful and trying to explore that. And I guess the other thing I want to say too before we stop, which is that for some, I have a 90-year-old uncle who's in an assisted living facility, and those people can't, no one can come in and they can't get out. And so he's very isolated and very bored. And we talked to him on the phone, as do other family members, and we got him on Zoom. It took some doing, but we got him on Zoom with his iPad, and he is now having lunch, virtual lunch with other friends in the assisted living facility. They had a they had a little cocktail party. And so, when people sort of say, "Oh, gee, it's too much for seniors, they can't get computers." That's a myth. And we seniors shouldn't buy into that, because this opened up the world for this man, and it can do the same thing for all of us.
And as I shared with you yesterday, I have a close friend who every day at 4:44 p.m. plays piano for his mother, and she tunes in on her iPad, and then he archives that video online. And now she has a playlist, and every day, she knows she gets a new song at 4:44 p.m. And throughout the rest of the day, she can go on and she can listen to weeks and weeks and weeks worth of him playing piano, and it's just this great way for them to maintain that connection. She's also in assisted living, but they have that connection and exists somewhere beyond the telephone. And it's something that when he was growing up, she watched him play. She probably supported him as he was going through his piano lessons, and now she has the ability every day to tune in and see him play. Dr. Ryan, we do have a question that came in, so I'm going to hand it back over to Julie in the studio, so she can ask that question.
Thank you. Um, Dr. Ryan, it's more of I'd love you to kind of make a statement for people. People are all through their lives, all up until March, had acted a certain way, reacted to things a certain way. They had a certain type of personality. They were the type that they could deal with anything, or they get stressed about anything, whatever it was. There's now a whole new avenue of reaction that people have. And can you just speak to how we all need to be kind and patient with people's reactions to everything that is happening, and all these the signs that you went over today, the things to watch out for, really critical, great information. But overall, nobody is the same as they were in January of 2020. Nobody is. Can you speak to the importance of realizing that in your everyday life and interactions with others?
Great question. Great question. I think that I think it's a profoundly disorienting time. I think we're in the same landscape, but everything has changed. And so it's really hard to get your bearings and sort of figure out where you are sometimes. So that's part of where the importance of trying, it's one of those times when you say, well, okay, is this something I can affect? Or is this something I can't affect? What are the things that I can do something about? And it's very tempting to say, I have no control. All of the control is out there, and nobody really seems to be in charge. So, or certainly not on a not so much locally, but on a grander scale. It's very confusing, and so that it's tempting to say I have no control over anything, and that's not true. We do have control over who's in our lives, what the quality of our life is, how we feel, what we can try to do, some of the things we've talked about to make our lives better. We were a very polarized nation before this started, and that somehow we've got to try to get back to the notion of we're all in this together, because it's going to go it goes much better for us when we all work together. I think some of what Mr. Warren was saying about the things that the town of Kingston has done. The reason the town of Kingston has done so well is that people have pulled together. You don't just wear a mask for yourself, you wear a mask to keep other people safe too. You don't just do socially distance for yourself, you do that to keep someone else healthy. The whole community benefits from your actions. So that's actually a lot of power that you have. And I think the other thing is that it is really important to be, none of us are at our best. So it's really important to be patient. And, the supermarket is a great example of that. I mean, all of us are trying to sort of make our way and get things that we need and not get in other people's way. And some of us take more time than others. I mean, I know for myself, I go in the supermarket and I think, gosh, it's not an art gallery, let's move it, people. But it's overwhelming. It's hard to make all these choices. It's hard. Everything that we used to do that was so simple is now much more complicated. So patience and tolerance, are super important. Be patient with yourself. You're not, if you can be kind and good to yourself, it'll be a whole lot easier to be kind and good to other people. And finally, there's some opportunity here. This is sometimes, psychologists and social workers are always trying to, say like everything's really fine, everything isn't really fine. But there's some opportunity here, which is that if there's a chance for us to stop and reflect about what really is important. A lot of really hectic life beforehand, maybe some of that wasn't entirely sustainable. Maybe there's a chance to do for us as a nation and as a society to do a reset and look at, okay, what is important? Maybe we can't do everything we could do, but maybe there's a chance for the quality of our lives to be better.
Thank you. That was wonderful. That was so well put. And I think people need to be reminded of that message all the time because it's easy to forget. And it's important to remember that everybody can ask for help because this is a time
Yes.
where asking for help it's okay. It's always okay, but especially now it's okay. Josh, that was all I had. Do you have anything final for today?
Yeah, I'll just close it out. Dr. Ryan, thank you so much for joining us. I mean, it's just been a wonderful conversation, and I certainly hope that the folks who are watching at home, learned a thing or two. I just want to impress upon everybody again, Paula Rossi-Clapp and her entire staff at the Council on Aging are in their offices. They're ready to answer phones. They're ready to provide outreach services as needed. Their phone number is 781 585 0511. Again, that's 781 585 0511. And if it's not a question that they can answer, they can certainly point you in the right direction. It's a great staff over there. It's a wonderful team, and they've been working on this since the pandemic hit and long before. I really think if you're accustomed to services at the Council on Aging prior to COVID-19, you'll see very little interruption or changes now that we're in the midst of it. One service that was interrupted was transportation services. There were some safety concerns a few weeks ago. Those have all been addressed, and transportation services from the Council on Aging will resume on Monday, June 1st. So that's this coming week. And they're already answering phones, they're already booking rides. So if anybody out there needs support with groceries, needs support going to medical appointments, please give the Council on Aging a call. Again, transportation services will resume this coming Monday, June 1st. And Julie, that's all I have.
Okay, thank you so much. And thank you, Elizabeth. You are wonderful. What a great guest. Wonderful information today. Really appreciate it. As you can see, we date stamp every time we do one of these. Today is the 29th, yes, of May. Next time we see you, we'll be into June. Crazy. If you want to see a replay of this, please go to pac-tv.org/Kingston. Please be safe. We'll see you next week. Have a good weekend. This is Julie Thompson for PAC TV. Good day.